So my name is Dr. Okemwa Job Ongubo. I'm the Chief Executive Officer of Mama Margaret Uhuru Hospital. This is one of the 5 level 5 hospitals that we have in Nairobi, but it is relatively one of the youngest in terms of existence in the county level service provision. So the hospital has been in existence from 2024 after it was handed over from Kenyatta National Hospital as a pediatric annex, and the county took up the hospital 2 years ago. So in this particular hospital, we are serving a very huge catchment population covering Korogocho, Kariobangi North, Babadogo, Ruaraka, and other areas beyond Embakasi North, which is the main sub-county and also the constituency bordering Ruaraka sub-county. So we have approximately 260 staff from the county, but we have additional staff that we have employed on locum and also casual staff that assist us in boosting the numbers, considering we are a level 5 hospitals. We offer a lot of services from preventive, promotive, including immunization, family planning, outpatient services, and also antenatal care clinics. We also offer inpatient services, including an accident and emergency unit. So we also have radiological services with an X-ray. We are expecting a CT scan soon. We are having a laboratory offering quite a large panel of investigations from biochemistry, full hemogram, immunoassay, and other services that usually offered. And we are a blood transfusing facility, and we have 3 theaters. So that is in the inpatient side. We have 3 theaters, and we have male and medical surgical wards. We have a pediatric ward. We have maternity, newborn unit, and a pediatric wing. Very soon we're going to open up a new wing for newborn unit because the current one is beyond capacity because of the increased workload. So the hospital is expanding, and we expect that in the future we are going to offer dialysis services. Already we have ICU equipment, but it has not yet been operationalized because of staffing issues and other requirements that are needed to run an intensive care unit service. So the facility, we want to thank the county for the heavy investment that they have put in the expansion of this particular facility. We currently have seen a sharp increase in terms of SHA revenue once we expanded the services, but we're going to do aggressive marketing also in the community so that we can ask wananchi to register for SHA so that they can receive services in the facility without much hassle. So we also received equipment under the National Equipment Service Program under the national government and the county, and through the inter-party agreement between Council of Governors and Ministry of Health and Social Health Authority. So we expect in a few years' time we are going to be a world-class and top-class referral facility. So we're in the progress of making a strategic plan. So we are in the process of developing a hospital strategic plan. We have never had one in this facility, so this will be the first one. So we have also developed a hospital website so that we can showcase the facility and other interactions from the community to the facility. You can book an appointment, apply for a tender, apply for a position, and also we are going to be showcasing best practices and good work in that particular website. And finally, we want to thank the Governor, His Excellency Johnson Sakaja, for working hard and also making the hospitals to be independent and fully. We really appreciate and we want to thank wananchi, and we encourage them to come to the facility so that they can access these particular services and not forget to register and pay for the annual premiums for SHA. Thank you.
My name is Moses Care, the board chair of Mama Margaret Uhuru Hospital. Our achievements at Mama Margaret Uhuru Hospital, we have expanded a new accident and emergency wing for male and female medical surgical wards. We have received equipment for theater and lab through collaboration with the county and national government. Very soon, our ICU and dialysis unit to be opened. And we are expecting to open CT scan very soon. And we appreciate the county government for supporting Mama Margaret Uhuru Hospital as we give service to Korokocho residents, Kariobangi, Babadogo, Lakisama, Mathare North, Utali, and residents of Nairobi County. They really appreciate that health is working, and we appreciate a lot.
My name is Josephine Mutua. I am the nurse manager at Mama Margaret Uhuru Hospital. Mama Margaret Uhuru Hospital was relaunched in June 2024. I was brought here to restart the hospital in May 2024. And when we came, we were a mixture of health workers, ranging from doctors, nurses, clinicians, lab technologists, pharmacists, just to begin the hospital. That was in 2024. When we came to this hospital, because the hospital was meant to be level 5, we started first of all with outpatient. We started with MCH. We made sure that everything was put in place. And maybe before I say much, I want to say that I oversee the nursing services. Currently, I have 71 permanent and pensionable nurses, and I have 19 locum nurses at the moment. So our services started slowly. We started first of all by beginning the outpatient MCH, that is services we give to children who have been born, immunizations, weighing, and the rest. Together with that, services like family planning, antenatal care services, postnatal services, that is where we began. Then the next thing that we did, we opened the outpatient services. We opened the outpatient for the pediatrics, those are children below 13 years, and also for the adult. We also opened outpatient for the adults. And as we continued, the community came to realize that the hospital has been reopened as a level 4 hospital, and they were very happy and supportive. And we had even the community members coming to get to know what they may help us with. I also remember the community elders coming and getting to know what services that we are giving. So the community was very supportive. Even they are supportive even up to this moment. And together with that, the community health volunteers were introduced to us. So from the beginning, we started with the community, and the CHPs from the community, they came on board. We started working together with them. As we continued, the second month, that was in June 2024, His Excellency John Sakancha came and officially launched the hospital. After the hospital was launched, we opened the pediatric ward, And we have progressively opened other services. After that, we opened maternity unit, that is labor ward, theater services, NBU, that is newborn unit, and we continued to open other services. As at now, we also have medical and surgical unit or wards. The last department to initiate is the accident and emergency unit, which we initiated or we operationalized in June this year, 2026. So Mama Margaret has progressively continued to expand. Per day, when you look at our records, outpatient we see close to 250 patients per day. That includes patients from clinics. We have Tumaini Clinic. We also have the dental clinic, and we also have special clinics on Tuesdays and Thursdays. So you find that daily we see outpatient to a maximum or to a minimum of between 150 and 200 patients in a day. Together with that, our delivery services or mothers coming to deliver in our service, in our facility, we have continued to increase. We started with one patient, but progressively now we are at least seeing or delivering up to between 10 and 15 mothers per day, which is a good number. So that is Mama Margaret. There are many other things that we are also looking forward to do. We want the services to be of the best quality possible. And recently we have received equipment in theater, we have received equipment in accident and emergency lab, also in the lab, and also in the radiography department. So Mama Margaret is increasing and the community is supporting us very well. When we came, the hospital also did not have a hospital on board, but His Excellency, the Governor, as in the last quarter, he introduced or chose board for us, and we are working well with the board for this hospital. So there are many challenges, and the key challenges include especially the staffing, and of course a few supplies and equipment. But progressively the hospital is growing, the hospital is expanding, and we hope come the next 1 year will be fully operational. Just something to mention is that now we have a newborn unit which has been renovated. We are soon going to launch it. That newborn unit will host between 80 and 100 babies at a time. So we want to appreciate also the Governor for giving us a chance to work in this hospital, and we still request for more support, especially when it comes to staffing, the nursing. We know the nurses are the owners of the hospital. The nurse is the one who will remain with the patient 24 hours. So we really request also the county government to remember us as an hospital when it comes to the nursing staff, so that we can continue to give the best services possible. Thank you.
My name is Dr. Kimai Omeli, the current medical superintendent, Mama Margaret Uhuru Hospital, a level 5 hospital in Korogosho. It's a new facility, 2 years old since the inauguration by His Excellency the Governor. So far, we are doing well. Our services are improving daily. From the initial point whereby we were just doing outpatient services to the current state whereby we are having all the 4 inpatient services. That's the maternity, that's reproductive health, and we are also doing pediatric units. We have medical and surgical wards. Our outpatient is one of our strengths because that's how our hospital started. We are seeing up to 100 patients in 24 hours in average. We've seen improvement from the previous situations whereby we were seeing 2 years down the line, we were seeing about 30 to 40 patients in 24 hours. So the hospital has seen we've seen market improvement in terms of service delivery. It's coming in majorly to help the other level 5 facilities that were in existence before. That's Pumwani Maternity Hospital and Mama Lucy Mama Lucy Hospital. It is also coming in to offload all the other level 5 facilities, including even the Mbagathi Referral Hospital and now the upcoming Mutwini Hospital. We have seen growth with the introduction of our new CEO, and generally we are at give it 60% of the capacity. We've had challenges before of infrastructure, some of the equipment that we needed for service delivery, but now day in, day out, we are expecting to get full capacity. We are giving an estimate or a future estimate time of maybe 1 year. In 1 year, we want to see our hospital to be in full capacity. Our hospital has a capacity of 450 beds, and hopefully if everything goes well as we plan, we are going to achieve. It's coming in to help the people of Eastlands because the only facility that was in existence is Mama Lucy Kibaki Hospital, of which from the numbers they are overwhelming. They are being overwhelmed. So Mama Margaret Uhuru Hospital is a new hospital in town, and it's a hospital that we are expecting to do even better with all what we are seeing. Otherwise, we want to appeal to the public and to the people of Eastlands to pay a visit to Mama Margaret Uhuru Hospital. I know it's a hospital that maybe is not known outside there, but we ensure that our services are up to standard. We are offering the best services in Eastlands.